The city of Bengaluru is now reeling from a major dengue outbreak. Now, we're talking about the city, which of course alone has reported over 900 cases between January to May this year, a huge spike from the 583 cases which were registered last year. Now, the state of Karnataka, we're talking about the entire state, which has recorded a total of 6,187 cases so far. Now, this is the data from the Department of Health and Family Welfare, which also has revealed that Chikmagaluru district has now the second highest number of prevalence of dengue cases, reporting 491 confirmed cases during the same time period. In fact, the rise in dengue cases has also strained the local healthcare facilities. There are a lot of patients that are now admitting themselves to the hospital because of dengue cases, and this has now led to the overcrowded hospitals and clinics, especially in places like Chikmagaluru. Limited resources are also being stretched to accommodate the growing number of patients requiring medical attention. So this clearly is turning out to be a very serious issue in the state of Karnataka, particularly in Bengaluru. Now, vulnerable groups such as children, the elderly and individuals with pre-existing health conditions are at a higher risk of severe dengue complications. The surge in cases has also heightened the concerns for these populations, requiring specialized care and also monitoring. Now, the question remains, of course, is what is the BBMP, which is one of the richest civic body in the nation? What is the BBMP doing about the rising cases? Some actions have also been taken to curb the menace, but none of them have been taken in time to prevent the viral surge. Why is India's tech hub unable to use ample finances or tech at its disposal to protect its citizens? That's a big question. And of course, in the end, one can say what famous filmmaker Andy Warhol once said about New Jersey. If this is the situation, why not declare mosquito as the state bird? Well, that's of course on a lighter note, but it's definitely not on a lighter note for those that are now dealing with these problems. In fact, we've also done a detailed report from the hospitals as well. Take a look.
As cases of dengue are on the rise in Bengaluru city, it is the children in the state of Karnataka who are most affected. Of the 6 deaths, 3 have been reported of young children. This is, of course, a cause of alarm now, as parents who are in fact noticing even the slightest of symptoms in their children are being advised to ensure that they are brought to a hospital and tested and not to ignore the smallest of signs. Remember that we're seeing almost over 1,500 cases being reported from Bengaluru city alone, and even as the administration, of course, claims that all efforts are on, whether it is from the source reduction to ensuring facilities at the hospitals, we'll really have to wait and see when the situation comes under control and when the state that's grappling with over 6,000 cases of dengue is able to ensure that the count comes down. We've been seeing that there's been a surge, but we're also seeing officials working on ground. Where is there a lag, sir? Why the sudden surge in cases? Is it the testing has been increased, or what? Why the sudden case surge, sir?
No, for the reason for the dengue mosquito is basically when we have rains and then the rain stops, when you have intermittent rains, so the water gets stored, and in that stored water these mosquitoes find a very fertile ground to breed, so breeding increases. So if the rainfall is continuous, then these mosquitoes can't produce so many larvae. So now that is one issue, and the weather also. Extreme temperatures are not good for this. Temperatures around 30 degrees are ideal for this dengue mosquito, and that is the climate in Karnataka and especially around Bangalore is very suitable for this. So intermittent rains and the weather is causing this spurt, and we are of course. We are trying to tackle it at the source itself, trying to reduce it at the source by spraying and educating people and bringing people to be more aware, not to store water, to be careful, not to leave water uncovered. So all these things.
Right, so that's the Karnataka Health Minister there talking about the condition in the state of Karnataka, what's happening there, what the state government is doing and all of that. And to discuss that and all the more in detail, joining us on the broadcast right now is Mr. Sathya Prakash, who's from the Congress, Sandeep Anirudhan, who's the founder of Citizens Agenda for Bengaluru, and also Dr. Ishwar Gilada, the Secretary General of the Organized Medicine Academic Guild. Mr. Sathya Prakash, you're representing the government here. Help us understand what exactly is the state government doing here, because like we see the graphics on the screens right now, the number of cases are significantly higher compared to previous years. So what exactly are the steps that your government is taking to ensure that the cases are curbed?
Sandeep, as our health minister, Mr. Dinesh Gundrao has himself said in your TV that we are doing an outreach program where we are doing, we are going to house to house. A lot of BBMP teams have been set up for every 1,000 to 2,000 households. All the households, nearly, whatever 1.4 lakh households, especially in the slums. Most of the slums we are concentrating first because that is the breeding ground where a lot of stagnant water is there. And nearly all the 14, ultimately we will reach out to all the 14 lakh households in Bangalore. There are roughly around 14 lakh households. So that is on one thing. Second thing he has said is NS1 test kits are going to be provided to all the primary health care so that, dengue cases, if any, can be found out very early. See, today what has happened is this intermittent rains, leads to a lot of water clogging, and this water clogging, larva, both Sara, it's a good breeding ground for that. So another thing what the BBMP has done is it has formed teams, all the health inspectors in each zones. They're going to all the 198 to 200 wards, going to each and every households, making awareness, that how they should, prevent dengue from coming in, how they have to be careful by using mosquito repellents, how they need to close the doors before 6 o'clock so that mosquitoes don't come into their house. And in case of any symptoms, what they should first do, how they should go to the nearest, primary health center and all the hospitals. In Bangalore, there is no much problem, but I know in the districts there has been some problem. But the state government is geared up. The CM, Mr. Sidramaya, and DCM, Mr. DK Shivkumar, have instructed the government that, it has to go on a war footing and make sure that dengue is to be brought into control in the next 5 to 7 days.
Right. Mr. Sathya Prakash, of course, you're talking about all the steps that the government is taking, but of course, the big question is what exactly is driving this surge? Our expert on the panel, of course, is Dr. Ishwar Gilada. Mr. Gilada, help us understand what exactly is resulting in this surge, because we're seeing that every year during this particular period, there's a particular pattern that we see as far as the number of cases are concerned, but this year, it is significantly higher, almost 1.5 times higher than the average. So what exactly is driving the change this time around?
Thank you very much for having me on the show. Basically, dengue and the chikungunya, they are transmitted through the same mosquito, Aedes aegypti. And recently, there is another new mosquito variety, which is called Aedes alba pictus. In 2023, most of the infections were through this new mosquito, which is called tiger mosquito. During this period, what happens? Then whenever there is a water coming from somewhere, maybe rainfall, maybe some water stagnation, and mainly because more than 80-90% cases are in the urban and semi-urban areas. So where the water stagnation is there, you go to any city, whether Mumbai, Calcutta, Delhi, there are a lot of potholes everywhere. There are a lot of places where construction is going on. Construction is halfway finished. Some government sites are also there. So when there is a stagnant water, mosquitoes are bound to be there. When the mosquitoes come, either you get chikungunya or dengue, and also malaria. So it depends on mosquito to mosquito. These mosquitoes bite during the daytime, whereas the mosquitoes required for malaria, they bite in the night time. Secondly, once mosquito is infected with the dengue virus, then mosquito is infective for whole life of the mosquito, and that will keep on transmitting. So it is not only transmission of dengue virus from mosquito to human being, but human being who is suffering from dengue will also transmit this infection to the mosquito, and then mosquito will become a carrier for entire of his life or its life, and therefore it keep on spreading. And that is the reason that some of the things which are not in our control, and our lifespan is not going beyond 71 to 73. We have come from 35 lifespan at birth in 1947 to 71 in male and 73 in female. But last 10 years we are stagnant. Therefore, there are some infections which are only for the tropical countries like India. And therefore, they keep on happening. The infectious disease. Secondly, it is a zoonotic infection. There are a lot of zoonoses happening. Thirdly, we are including a lot of atmospheres of other insects, other mosquitoes, other animals. So it is not merely dengue, it is not merely chikungunya, but there are so many infections where as human being, for our own survival, we try to include in the other atmospheres and we pick up from there. And more than 50-60% infections currently which are happening are viral infection, number one. Number two, they are zoonotic infections. So we need to decide our borders. Similarly, if we try to include other environment, we are also inviting a lot of trouble from that environment. Over to you.
Right. Dr. Gilala, of course, you're talking about all the reasons why there could be a potential surge here. Also joining us is Sandeep Anirudhan. Sandeep, this is, of course, now Mr. Sathya Prakash, who also listed out a very long list of things that he says the Karnataka government has done so far. I was almost running out of space on my notepad trying to list all of those. But Sandeep, do you think these steps have been effective so far? Because while they, of course, claim that a lot of steps are being taken, none of them seem to have worked. The number of cases are only surging.
Ashish, see, what came out very prominently in what the health minister was talking about, what doctor was talking about, is that things are changing very rapidly. You're having newer disease patterns because our environment is degrading. Because, see, we didn't have dengue outbreaks like these 10 years ago, 20 years ago. These are very recent happenings. Last year, it was already alarming. This year, it's even worse. From what I hear, I think cases are being underreported. Most hospitals, an entire floor is actually devoted to dengue cases now. Especially Manipal Hospital, an entire floor is filled with dengue patients who have been admitted. But what's significant to note is earlier it was not happening.
Sandeep, that's a
Because
very
you didn't
serious thing that
have.
you're saying.
Exactly.
Sandeep, are you saying that the cases in Bengaluru are being underreported?
Of course. Uh, I'm just talking of one hospital. I went to the hospital, an entire floor is filled with dengue patients. So just multiply that with all the hospitals in Bengaluru. It's obviously underreported. It's all over the place. But what we need to,
Right.
the,
Okay.
the highlight that I'm talking of is the health minister was saying now we have conditions of every time it rains, you have stagnant water, but also the temperature is high. Earlier, every time it rained in Bengaluru, you used to have a chill. So mosquitoes were not reproducing. Now you have warm, humid conditions after every rain. This is a big shift that's happening climatically in Bengaluru. Why did this happen? Because we have destroyed our city's green cover. We have destroyed 97% of our green cover and we have concretized by 95%. Therefore, what's happening? Our climate has changed. It's become hot and humid all the time now. So it's leading to new disease patterns. This is what we have to actually focus on. We shouldn't be worried about dengue only when it appears. Why is this shift happening? Because the environment is destroyed. We have to recover it. We have to bring back green cover and we have to ensure that the temperatures stay down.
Right.
That is
Of
the
course,
big message in this. I
Sandeep,
don't
there
know if
are
the
a
government is noticing.
larger thing that we can focus on, the larger problem, and of course, all of these are the after effects of it, like you're pointing out. Mr. Sathya Prakash, Sandeep is now saying that there is also a possibility of underreporting of cases. Is this also one of the things that your government is doing to counter dengue menace?
Absolutely. That is why I said NS1 testing kits will be given beyond the government hospitals. Also, government is thinking to give these test kits so that early detection of dengue can happen. The problem before the government is two-pronged, and they are acting on it. On one side, they have to see that the larva in the stagnant water has to be attacked with the pesticide. So what BBMP is doing is in all the wards they're putting these guys with all the sprinklers who are going to hole wherever stagnant water is there. They are pumping all the pesticides to that so that larva doesn't multiply. The mosquitoes don't multiply on one side. Second thing they are doing this mission activity also where they are pushing that smoke into all the trees and small shrubs
Mr.
in
Sathya Prakash,
residential areas.
Sandeep pointed out at a very important problem. Sandeep is saying that there is also potential of the number of cases of dengue in Bengaluru and across Karnataka being underreported. Is your government doing anything to counter that?
No, it might be underreported because testing kits might not be available. Now, government is saying that testing kits will be available in most of the other hospitals also, small-time hospitals. So, any cases are there, it will come out. In a day or two,
So are you admitting that the number of cases are higher than what's being reported?
no, as of now, I am telling whatever reports have come to the health and prime, they are reporting it. Now, if Sandeep is telling something else is happening, I think he is the man on the field. If something is happening, we will go all out and we will see to it. Such underreporting doesn't happen is all I am saying. We will do more testing. And someone
And
should not,
Ashish, I want to highlight one more aspect. This particular mosquito, and a doctor might be able to validate it, it breeds in fresh water. It doesn't breed in dirty water like sewage and stuff like that. So by spraying in sewage, it's not going to control this mosquito. It's basically, even if there is you have these street vendors and those water cups, paper cups. If there's rainwater in that, it will breed in that. It will not breed in drainage, sewage water where normally BBMP staff go around and spray. So this is very important to note.
Right,
Can
right.
please check with doctor if this is right.
Correct, correct.
Absolutely.
We'll
Like
get
Sandeep
Dr.
said,
Gilada to talk about that. Dr. Gilada, you just heard there Sathya Prakash and also Sandeep talk about the steps that are being taken by the government to counter dengue, to ensure that there's no spread or something. Do you agree that there, of course, the steps that are being taken by the government are just not effective? Do you think something more also needs to be done? Dr. Gilada, I think
not
you're
able.
muted right now. Dr. Gilada, please unmute yourself. You're muted right now. Right, I think we'll fix the audio issue there with Dr. Gilada. But Mr. Sathya Prakash, now clearly one of the voices that we are hearing from the citizens is clear that the steps that are being taken by the government are just not effective. So are there any more steps that you plan on taking in the future as well? Because this continuously now, the pattern that's emerging is that the surge is just going up and up.
There's no politics here, Ashish. Sandeep ji also has said that this larva is not going to be in the drains and all. So we need to look at, out of the box thinking. He's telling in cups of water where it is there, in other waters, wherever there is vegetable spread, there some water is there. So definitely we will take all these things into our consideration, and our focus is to bring this disease down as fast as possible. We will do everything possible. On one side, we will see that the larva doesn't breed anymore, the mosquitoes don't breed in a higher ratio. Second thing is we will look at all those who are affected, and we will make sure that enough beds are there, enough testing kits are there, enough help is given in all government hospitals and PHCs, not only in BBMP or Bangalore, but across the state. And our health minister has gone forward and said, if any support other hospitals also want, like giving testing kits,
All right,
we are ready
all right, Dr.
to do
Prakash,
that.
Mr. Sathya Prakash, will talk about all the steps that the Karnataka government is taking, but also let's get Dr. Gilada in here. Dr. Gilada, if I believe your audio is fixed now. Now, you just heard Sandeep and Mr. Sathya Prakash talk about all the steps that are being taken by the government to ensure that there's, of course, no spread of dengue. Do you think these steps that are being taken by the government right now are effective? Do you think there is some sort of a spread that also is caused beyond this?
See, governments everywhere are the same and they are taking the steps. Sometimes they are knee-jerkism, sometimes they are taking proactive steps. But basically, we must understand this virus particularly. This virus has no vaccine to prevent, so you cannot prevent dengue. And this vaccine has this virus has no treatment. So if there was a dengue patient, if you treated that person, then that person will not transmit infection to another mosquito or another person. But this is not happening. And therefore, we are totally dependent on mosquito fogging, mosquito repellent, avoiding mosquito to bite, which is in nobody's hand. We are asking people to wear full clothes, etc. So basically, we need to wait and watch. Government should take proactive steps. People, everybody has to guard themselves. You cannot depend on government. And there will be more than 50% cases here. They are asymptomatic. So when you say underreporting, all infections are in the country are underreported. Nowhere in the world they are fully reported. Somewhere the ratio could be 1:2, somewhere it could be 1:10. So underreporting is everywhere. But we cannot blame underreporting because reporting based only on testing. Those who will go to hospital who have symptoms. Some of them know that dengue has no treatment. They take a paracetamol at home and they sit at home. They know that nothing much is going to happen in the hospital.
All right.
So in that case, those only proactively going to hospital, they will be tested. In that, they will find somebody positive for chikungunya, somebody for dengue. So we will not get a clear picture. But we know that it is on the rising trend. We know that hospital beds are filling up. We know that doctor after doctor is telling that there is a lot of dengue and
absolutely.
chikungunya.
Dr. Gilada, I'm
So
afraid we're running short of time on the broadcast. Appreciate Sathya Prakash, Sandeep and Dr. Gilada for joining us. I really apologize because we don't really have much time left on the bulletin. When of course, this is a very important discussion that we continue to keep having, and of course, we'll be raising as well. We'll be keeping a close eye on the number of cases